Good evening, everyone. Can I start the introduction?
To this session by Dr. Nilanjana. This is one of the first initiatives in terms of spreading awareness about various healthcare issues from the healthcare vertical of SCSC. Okay, we regret there is a small technical glitch happened till now, and now we have gone live. I request Dr. Rajiv Menon to start the session.
Yeah, thank you so much, and welcome everyone for this amazing session. It's indeed an honor and privilege for SCSC that today we have with us one of the most accomplished ophthalmologists in the city, Dr. Nilanjana Dev. She is presently in Smart Vision, and she finished her MBBS from Calcutta and then went on to do her MD as well as fellowship in one of the most premier institutes in the country from Shankar Nethralaya. And after that, she finished her PhD and MPhil and also fellowship from University of Edinburgh. As all of us know, sudden loss of vision is something which is extremely dangerous, and many a time we tend to ignore, or many a time we don't tend to identify, because we have two eyes, and when we start losing vision in one eye, we may not know that there is something wrong going on unless it's too late. And for a cardiologist like me, also, it's going to be an extremely important talk, so that we can actually make our patients understand what are the do's and don'ts, and when they should immediately seek medical attention. I think with those words, I would again like to welcome and thank Dr. Nilanjana for taking out time from her busy schedule and being kind enough to be physically present in SCSC and then sharing her experience. So over to you, madam.
Slide. Can we have the slide full screen? Yeah, good evening, everybody. So, February being the month of low vision awareness, so we've selected this topic today. So, I'll be talking to you basically about conditions which can cause loss of vision and how to make the patients aware of that. So, what is low vision? Vision loss which cannot be corrected with glasses or contact lenses and it interferes with our daily activities is defined as low vision. So we have seen this chart many times in our ophthalmology clinics. So this chart, the first letter is 6 by 60. That means that a patient who should be able to read it from 60 meters can read it only at 6 meters. So that is extreme low vision. So as we go down, the letters become smaller. So when we come to this 6 by 12 line, so beyond this means we are supposed to read actually till the last, a person who has normal vision. But if we skip these three lines and the person is able to read only up to this line, so that is a 6 by 12 line. Okay, so normally he should read at 12 meters, but he is able to read it only at 6 meters. So at this level, our normal daily activities start getting impaired. So apart from this reading chart, we have other symptoms also of low vision, which I'll show in the next slide. So this is like a scotoma or a blind spot in the center of vision, or the center of vision is clear but the sides are blurred. So this is a field loss, means the peripheral vision loss. Sometimes patient can also present with lack of color vision or contrast sensitivity. So they can see the bright colors only, but they are not able to see the lighter shades. And finally, like having blurring of vision. So these are the four main symptoms of low vision. So when we come to the global population vis-a-vis the Indian population, we see that in the 7.8 million global population, about 1.2 million Indian people, India has a huge population. And if we see the low vision figures, 255 million worldwide, they are having low vision, out of which 70 million are in India. If we consider the blind population, 49 million people worldwide are blind, of which 5 million belong to India. So more than one fourth of our population, that is 25% of the population above the age of 50 years, they have low vision in India. So what are the leading causes of blindness? The most important preventable cause of blindness is cataract and refractive errors, but we are not going to deal with this at this session. In this session for today, our topic is diabetic retinopathy, age-related macular degeneration, and glaucoma, which are the three main blinding diseases we face in India. So we have taken it as a case-by-case basis. So we have a 32-year-old male presenting at our clinic with a history of diabetes, and he is having a type 1 diabetes. That means he's on insulin. He's a little obese, about 90 kgs of weight, not very physically active. He's mostly sitting on his laptop all the day. He started complaining of black spots in the field of vision in the left eye since 1 month. So after the preliminary eye examination, we advised him to undergo a dilated retina examination. Now, many people in my clinic, when I tell them to get dilated, they say we have come from a far distance, we have to drive, we cannot dilate. But this slide shows us the importance of a dilated eye examination. So we have to put drops for dilatation and wait with our eyes closed for half an hour, and then the pupils dilate. So this is the window to the eye. So unless this is visible, we cannot see what is happening inside the eye. So this shows as to, like, if the pupil is not dilated, we can see only about 25% of the retina, this much. But with a dilated pupil, we can see nearly 90% of retina. So if we undergo a dilated examination, then only we can see all the problems which are happening inside the retina. Sometimes we see like patients having holes, breaks in the retina, which can get missed if the patient is not dilated. So a dilated retinal examination is must and is a comprehensive part of an eye examination. So how do we do the eye examination? We'll go through this briefly. So we have this indirect ophthalmoscope through which we can see all the periphery. And for the central part, that is the macula, what we call as the most sensitive part of the retina, we use a 90-degree lens. So this gives us a magnified view and the finer blood vessels are all visible. So here we have this retina, which is normal. This is to show you how a normal retina looks like. So this is the optic nerve. So this nerve carries the visual impulses from the eye to the brain. And this is the central part called the macula, which is responsible for very fine vision, color vision, reading, writing vision, everything comes from this place. Now in our patient, in the left eye, we saw that there are a lot of these blood vessels which are growing from the optic nerve, and they're all going towards the center of the retina. Normally the retinal center should be all free of blood vessels, but in this case we see that the center of the retina is also having multiple new blood vessels. So these are all abnormal, newly developed blood vessels. Now we advised him a test called a fundus fluorescein angiogram, which includes a small injection of a dye in the hand, and then we take photographs of the eye with the fundus camera. And this dye, which passes through the blood vessels, it helps to identify the pattern of the blood flow in the layers of the back of the eye, that is the retina and the choroid. So when our patient underwent the fundus fluorescein angiogram, we could clearly see this abnormal front of new blood vessels on the optic disc, which is totally abnormal. And in various other quadrants, we could see this white leakage points. These leakage points indicate potential areas of blood leakage. In the right eye, he didn't have any complaints, but the angiogram showed that he has all these gaps here. These black areas indicate that the blood supply is lost. So this will eventually lead to the formation of new blood vessels, because then nature tries to compensate by creating new blood vessels. But these new blood vessels are abnormal blood vessels and they are prone to bleed. So this patient in the right eye also had problems which needed treatment. So, what is diabetic retinopathy and what is the magnitude of the problem at hand? So, if you see here, this is the normal retina and the normal blood vessels. In diabetic retinopathy, what happens is that the blood vessels start becoming leaky. So, the joints in between the cells of the blood vessel, they start oozing blood and fluid, which cause swelling in the retina, and this is called non-proliferative retinopathy. But as I showed in my earlier slide, that there's loss of blood circulation that leads to the development of proliferative retinopathy, where abnormal blood vessels can grow on the optic disc and on the sides of the retina and has a higher risk of bleeding in the eye. Now, statistics show that out of 425 million adults who live with diabetes now, about one third of them will develop diabetic retinopathy after 3 to 5 years of diagnosis. So, as soon as you get diagnosed with diabetes, it is imperative to have an eye examination. We should also not forget that the diagnosis can also happen late, that we may be having diabetes without knowing it. So, that is why the importance of having an eye examination as soon as you are diagnosed with diabetes. And it is a progressive disease. So, after 15 years of diabetes, even if it is under good control, 98% patients with type 1, that is insulin dependent diabetes, and 78% with type 2 have some degree of retinopathy. India has 77 million people with diabetes, which is rapidly going to increase to 125 million by 2045. Out of these, about 9.6, this 9.6 is out of the 77 million presently, about 12.5% already have diabetic retinopathy. And out of this 9.6 million, nearly one third, that's about 3 million, they have vision loss due to diabetic retinopathy. So early diagnosis is must, and the treatment also yields good results, is easier to perform, and cost effective for the patient. Is much cheaper on the patient side if he gets diagnosed early and we treat him for that. So in this patient, what we did was we did laser all around. We have to understand that the lack of blood circulation causes this new blood vessel formation. So we ablate the peripheral retina with laser and reduce the oxygen demand. Then we see the regression of the new blood vessels. We see here that the optic disc has become normal and the new blood vessels have nearly disappeared. But not all these patients present so early at this stage. Suppose a patient presents in a more advanced stage with already a blood clot, a huge blood clot inside the eye, then a laser will not be possible. So then we have other options like we have an anti-VEGF, that is vascular endothelial growth factor inhibitor injections. So this we inject in the eye. So the injection is done like this and the medicine is directly injected inside the eyeball cavity, and it comes in direct contact with the leaking blood vessels on the retina. Suppose the patient ignores this stage also, or he has not presented at this stage, what will happen is that the blood clot inside will start retracting, it will start shrinking, and then it will pull the retina away from its normal position. And this is called a tractional retinal detachment, and this leads to very severe loss of vision. In these cases, we cannot do an injection also. So what we have to do is a surgery called vitrectomy. This vitrectomy surgery is where we remove the complete gel from the eye, remove all the membranes which are pulling the retina, and then push the retina back and settle down with silicone oil injection. So this is in brief how it looks like when we do the vitrectomy surgery. So we have another patient who presented with He's a 55-year-old gentleman having a history of diabetes since 15 years, also has kidney affection due to diabetes. He complained of blurring of vision and fading of colors. So when we examined his eye, we saw that his vision had dropped down to 6 by 36 in the right eye and was 6 by 9 in the left eye. On eye examination, we found that there was a large area of retina in the center which was swollen and had all these cholesterol crystals deposited on the retina. Then we did a test called an optical coherence tomography, which is like simply like a CT scan of the eye, where we see that this retina should be flat like this, and there should be a curve here. But in our patient, this retina was swollen. There was a lot of this bubbles of fluid accumulated in the retina, and these white spots are the cholesterol crystals, which we see with the fundus examination. So in this case, laser is not possible. Laser is not the solution for all cases, because here the patient has got a gross swelling of the retina. So if we do laser, this swelling is going to increase. So what we did was to have an injection of an implant, that is the intravitreal Ozurdex implant. So this is a tiny piece of steroid which goes into the eye like this, and then it slowly keeps releasing the drug for 3 to 4 months. And then after this post treatment, we see that the retina has become flattened, and after that, after the retina is flattened, then we have to do the laser to all the leakage points. So now we see post treatment beautifully the crystals have come down and the patient's vision also improved. So what are the risk factors of diabetic retinopathy? So first and foremost is the duration of diabetes, how long you've been having the diabetes. Next comes genetic factors. Some people have family history of diabetes, parents, uncles, aunts, they're having diabetes. So these people are more prone to develop diabetes. Then poor metabolism, like you're eating more, exercising less. And some people they have the digestion, everything is at problem. Then these people with a poor metabolism are more susceptible for diabetic retinopathy. Food habits are very important. We'll come to this later. Work habits, a sedentary lifestyle, not having much physical activity is a big risk factor. Obesity, being overweight, smoking, and alcohol abuse. Now, how do we prevent diabetic retinopathy? So, a regular dilated eye examination. Suppose the eye is normal, we have seen him at a non-proliferative stage, then every year eye examination is compulsory. And if it is at a proliferative stage, then every 3 months is mandated. Good control of blood sugar and HbA1c every 3 months is necessary. Healthy heart, exercise regularly, avoid alcohol and smoking to the extent possible. So now we come to the diet. What should be the diabetic diet? I am sure that every diabetologist will tell the patient what to eat, what not to eat. But in the general interest of the audience, I'm just mentioning that this your plate should contain at least 50% of fibrous vegetables. This is must. Fiber is very important. Next comes 25% protein, because we know that high sugar causes muscle mass loss. So protein intake is must. It could be a vegetarian protein or a non-vegetarian source of protein. Carbohydrates have to come down, so it is only 25%. So what are the things which you can eat, what you can't eat? Like fish, cheese, salad, plenty of water, fresh fruits. Then you can, it's not that you can not at all have ice creams or cakes, low carb cakes or sugar free ice creams. You eat real meat, not processed meat. Vegetable pasta, not a pasta which is made of white flour. And burgers without bread, avoid white bread. Red wine, spirits. So the red wine and spirits, they are good, but avoid like all these burgers, fries, fast food, these to be avoided. Now many patients ask me fruits. I like fruits, but many fruits have got sugar. So what are the fruits I can take? So I've included this specifically for those patients who love to eat fruits, and fruits are very healthy. They have a lot of fibers. They are low in carbohydrates. So papayas, watermelon, muskmelon, pear, guava, pineapple, sweet lime, oranges, apples, amla, jamun, pomegranates, all can be included, but with a restricted portion size. That's very important. So next comes our third patient, who is a 65-year-old lady who is hypertensive. and who complained of a central spot in the field of vision in the right eye. And in the left eye, she said that the straight lines appeared a little distorted and crooked. So, what did we find on the eye examination? We found a membrane, a grayish layer here with a lot of blood all around it. And in the left eye, we can see the small dots, yellowish dots on the sides of the central retina. So when we did the OCT, we saw that there is a layer here which has got lifted from the center, and there is this black space. This is fluid leakage. So this retina is leaking fluid and blood. In the left eye, we can see these elevations. These are the abnormalities in the retina due to aging. So she was diagnosed as having age-related macular degeneration. Now, how does it evolve? So initially, it starts with small deposits of this debris under the cells of the retina. Gradually, they increase in size and start affecting the center, and then this distortion thing starts. After some time, what happens is we have a condition called geographic atrophy. In geographic atrophy, what happens is these retinal cells, they undergo degeneration, and there is a loss of the retinal cells, and the photoreceptor, that is the light receptors, they get damaged. Then we get this kind of spots in the central retina, and this is called profound loss of reading writing vision. Now here also there is a risk that through these gaps, the new blood vessels can proliferate and come to the center of the retina and cause blood clots in the center, which our patient had in the right eye. So what is the treatment? Treatment is only possible for a wet AMD. Wet AMD means where the bleeding and the leakage of fluid has started. So again, there are this eye injections, because we have to inject the material directly into the surface of the retina. No eye drops or tablets can penetrate into the eye. So many people ask if it can be cured with eye drops. So it's a big no, it cannot be cured. It has to be injected. So there are these different options available like Lucentis, ranibizumab, Eylea, Paginex. So these are the different injections depending on the efficacy as well as the budget of the patient, because these injections can go up from 20,000 to around 50,000 per injection. So depending on the budget of the patient, we decide what is good for him and we give him the appropriate treatment. So in this patient had, so these injections have to be done monthly once for 3 months. And after 3 months, we keep assessing just by OCT whether the membranes or the fluid leakage is recurring or not. So this was the condition before treatment. And we see that after the injections, the fluid in the retina has subsided. But unfortunately, this patient presented to us very late, and we have this scar formation in the retina for which her reading writing vision was permanently impaired. So what are the risk factors? Main risk factor is age. Age above 50 years, smoking, genetic predisposition. Females are more commonly susceptible to AMD. Then exposure to sun, high fat foods, high blood pressure, and increased body weight. So how do we prevent AMD? So after 50, every year you should have a regular eye checkup. Whether you are having any symptoms or not, a regular eye checkup is mandatory. Exercise, protective glasses when we go out in the sun, and a healthy diet. So this healthy diet, see this pyramid, this is called a healthy food pyramid. So this pyramid shows what are the things which we can have more and what are the things which should we have less. So we have all these fruits, green vegetables in the base here, and then we cut down on the grains, carbohydrates, so we have lesser amount of these grains, potatoes and legumes. Then we have seafood is rich in this omega 3 omega 6 fatty acids, so we can have this seafoods. Next we have this poultry, eggs 2 to 3 times a day. And last is your meats and sweets, once a week only, and avoid processed. So no biryani in Hyderabad. Prevention of AMD. How do we prevent AMD? Now, there is a study, landmark study called the Age-related eye disease study, which has shown that this is the composition of the medicine. If we take like 2 tablets a day, then we can prevent in predisposed individuals the formation of AMD. There's a simple test called a Amsler chart. This chart consists of this very interesting test, and I give it to all my patients with AMD. So this is a chart which has this vertical and horizontal lines, and there is a central black dot. So you have to ask the patient to look at this dot, and while looking at the dot, do you see any areas which is curved or which is missing, any corners, there are gaps or any black spots? So the patient can do this every once in a week or twice in a week, and as soon as she detects any changes, she can report to the doctor. So this is a home test available. So this is called an Amsler home test. So this test is very sensitive to pick up these kind of retinal problems. Now we have our fourth patient. He is a 54-year-old gentleman, diabetic. His father had history of loss of vision, and he complained of decreased sight vision and difficulty in driving. So we suspected glaucoma in this patient. So we did a test called an applanation tonometer. This applanation tonometer, this is the machine, and we put a dye in the eye and we use this blue light to check the pressure. This is very, very important. Most of the hospitals now they have this air puff for the non-contact tonometer, which throws this puffs of air in the eye and artificially increases the pressure. So that is just a screening kind of test, but to diagnose and detect glaucoma, we have to do an applanation tonometer. So just to cut off that jargon, I just ask my patients whether the eye was checked with a blue light or not. So they say no, blue light test was not done. So that gives me the information that he was not having the eye checkup, the eye pressure measurement properly in his local hospital. Then we do another test called gonioscopy. Gonioscopy is to see the drainage angle. See, normally when we put this lens, this is a special contact lens on the eye, which we put on the eye after anesthetizing the eye. We can see this, there's a drainage part of the eye. This is the drainage area. We should normally be able to see this drainage area. But when glaucoma develops, then this drainage area can get closed. So this is called a closed angle glaucoma. Now the more common cause is the open angle glaucoma. In this, what happens is that this mesh is visible, but the pores are closed, just like a clogged tea strainer. The strainer, you can see that the pores are clogged. So here also the pores are clogged and they're not able to filter the fluid out of the eye. So this is how we do the gonioscopy test. Now, optical coherence tomography has revolutionized the treatment of the diagnosis and treatment of glaucoma. So we can do this test in glaucoma, and you see here that this is the normal pattern of the eye. This is the cornea, this is the iris, that's the brown part of the eye. So it should be open like this. This is the normal, or in an open angle glaucoma, we can see that the angle is open. But if the angle is closed, like I showed you in the earlier slide, then this iris is elevated and the drainage passage we cannot see. So this leads to the buildup of fluid pressure in the eye, and this buildup of fluid pressure affects the optic nerve and causes optic nerve damage. Then also we measure the corneal thickness because we are touching that blue light. So if the cornea is thicker, then artificially the pressure will be elevated. So there are a lot of patients who are on glaucoma drops, but they don't have glaucoma. So we have to do a corneal thickness test to assess whether the real pressure is being estimated or not. Then we have this optic nerve head and the RNFL analysis. Briefly, I will just tell you that a normal one looks like this. There should not be any colored patches here, and everything should be in green. But once we have glaucoma, these colors show up. Means this is the red zone is the warning zone. This is the danger zone, and the yellow zone is the warning zone. Normally, we should have everything in green. So as I said, there are two types. There's the open angle type where the angle is open, but here you see that the pores are clogged. And there's a closed angle type where the iris is lifted up and there is the drainage passage is very narrow. Now what happens when the eye pressure builds up? If there is a fluid pressure building up inside the eye, the normal optic nerve looks like this. Due to the pressure, the nerve fibers start getting damaged. So the central cavity, this should be small. This should be only about 30 to 40% of the entire optic nerve. This cavity starts getting increased. So this is called a cupping. We can see that it is nearly 70% cupped. And in this one, we see that hardly there is any kind of nerve fiber. The whole thing is empty, and this only the fibrous tissue is there. All the nerve fibers are lost. So after seeing this, we advise the visual fields. So this is the normal visual field of the patient, which is completely white in color. As the sight vision starts decreasing, we can see that these black patches appear on the periphery. And when it goes to an ultimate stage, like in this patient, we had the left eye, which had a very severe loss. The fields presented like this. And this is the zoomed 10-degree field. So this is, we are measuring the 24-degree fields, the side vision of the patient. If we zoom this area, we see that this central part, only half is there. Half is already lost. So how do we treat such patients? So as I already mentioned that this is the normal eye and this is the drainage passage. So this drainage passage becoming clogged, the fluid starts building up and it affects the optic nerve. So in this way, gradually the optic nerve starts getting damaged, ultimately like resulting in this side vision loss. So, and this is a severe damaged state. So this is a normal field, then it comes to this stage, untreated it goes to this stage, and then it comes to this stage. And at this stage, patient even has difficulty in walking in his own room. He will be stumbling on objects. He cannot see any, he cannot lift the glass from the table because he has only a small tunnel vision. His peripheral vision is all lost. So the treatment in early stage, again, as I mentioned in my earlier slides also, always easy if it's diagnosed early, and we can treat by medicines alone. So there are various options available. Should be very careful that these are not like ordinary drops, like cooling drops or so. So these have to be applied in a special way where there is the drop goes totally inside the eye. We close it for some time and then we wipe off the excess because these drops are very strong and can cause skin allergy rashes. If they cause skin allergy rashes, you have to discontinue the drops and then the eye pressure will again go up. So I take a lot of time to counsel my patients how to apply the drops properly, and these drops have to be preferably maintained at a cool dark temperature of about 25 degrees, like below 25 degrees. So I always tell them that below 25, below 35 difficult to measure. So for safety side, put it in the fridge at 4 degrees and change the bottle every month. Even if the bottle is remaining, change it every month because it loses its efficacy. There is also an option of laser in both the open angle and the closed angle. So in open angle glaucoma, what we do is that we make this kind of laser burns on the, as I said, that the pores are clogged. So we can make holes with the laser on the pores and help them to open to a certain extent. So this is called argon laser trabeculoplasty, and this is the laser for the closed angle where the iris is coming forward and the drainage angle is closed. So we make an alternate bypass channel here by making a hole in the iris so that the fluid keeps flowing and the pressure does not rise. But these only have a preventive role. Now, when we come to these kind of advanced cases as my patient had, the treatment is usually surgical. So in surgery, what we do is that the normal passage is clogged or blocked. So we create an alternate passage here surgically and make a window for the fluid to flow out through this hole into the outside part of the eye. In some complicated cases where, because this particular eye, it has to have this white eye, preferably virgin, means no previous surgeries has happened. These cases we can do this trabeculectomy surgery. This is the gold standard surgery. But there are many patients who have complicated cases where they have undergone previous cataract surgeries or previous retinal detachment surgeries. So in those cases, there's no other option but to put a stent. So we can put stents in the eye also. So this is the Ahmed glaucoma valve. This is an imported valve, more costly, but the advantage of this is there's a valved device. There's a valve inside, so it can control the fluid flow outside the eye. There's an Indian counterpart. This is called the Adi valve. There is no valve here. It's a non-valve device, so the fluid flow is not controlled. So sometimes it can lead to very low pressure. High pressure is not good. Very low pressure is also not good. So this is a shunt which we place, but we put a stitch here. So gradually we can monitor it and then slowly release the stitch when we see that the optimal pressure has been achieved. But in my practice, I usually prefer the Ahmed valve because here we don't find much complications as we see with the Adi valve. Now, what are the risk factors? First and foremost is high pressure, high eye pressure, then age, family history. One third of patients of glaucoma have a positive family history. So I always ask them, has somebody lost sight or has somebody, because they may know, they say, they ask me, what is glaucoma? So that term glaucoma is also not familiar. So I ask them whether anybody in the family has lost sight, or is anybody in the family who's using drops for many years. So that gives an indication whether there's a positive family history or not. Then being short-sighted, wearing high minus glasses. The short-sightedness is a risk factor for glaucoma. Then Africans and Asians, they are more predisposed to have glaucoma. Systemic diseases like diabetes, high blood pressure, and then over-the-counter medications. Very important. We have a red eye, we go to the pharmacy. Who will spend so much money to go to an ophthalmologist? So we go to the pharmacy, we take some drops, the eyes become white, and we are happy. But those eye drops contain steroids. So this over-the-counter medication. So whenever we have dryness or red eyes, we put these drops. So there are many patients who come with this. They don't know that it's a steroid, and these steroids can lead to eye pressure increase, and this is totally asymptomatic. So we should avoid this over-the-counter medication. Prevent, again, exercise, no alcohol, no smoking. All smokers and alcoholics will be like, angry with me, but I really don't mind as long as their eyes are healthy. Control BP, regular health checkup, regular eye checkup, and maintain a healthy weight. Now everybody is into yoga and fitness these days. In glaucoma, there are certain yogasanas which should be avoided. These kind of yogasanas are basically asanas where we put the head down and the body up. So these should be avoided in glaucoma because it increases the eye pressure. Pranayam is possible, allowed. Now coming to the end of my slide presentation, we'll give some general tips for eye health, like go for regular eye checkups, look away from the computer screen every 20 minutes, use safety glasses, anti-glare glasses while at work, or shades where you're going out in the sun, maintain proper eye hygiene. Now, especially after this COVID pandemic and all, we have seen this hand sanitizers and all. Even hand sanitizers, if it touch the eye accidentally, it can cause allergy. So we maintain a proper hygiene. Don't put your eyes in the hand. Don't rub the eyes. Don't smoke. Wear sunglasses. Exercise. Now, for the people like who are in the IT sector, a lot of time on the computer. So regular eye checkup is a must. Eye exercises. Keep rotating your eyes. Keep rotating your eyes. Why? Because the eye muscles are very delicate. So on constantly focusing at a bright object, the eye muscles get strained. So if we keep turning our eyes, then firstly the eyes get shifted away from the screen, and then all the other muscles get active, and the eye muscles which are used to focus on the screen, they get relaxed. And then proper lighting is very important. Never try to read in the dark or see your mobiles in the dark, because that blue radiation and all, it damages your eye. A lot of people, they lie down and read. That's not a good habit, because when you're wearing glasses, the glasses, they are made in such a way that you should be sitting and reading. The axis is not maintained when you are lying down. Cleaning your monitors, very important. Dusty monitors, greasy monitors, they increase your eye strain. Adjust the distance to between 40 to 76. Don't stoop on the laptop, because it will give you a back pain, neck pain, all these problems will start. Glare reducing by using anti-glare screens. Increase the font if you have a low vision. Okay, don't try to screw your eyes and try reading the small prints. So even in the computer or in the mobiles, increase the font size, increase the brightness when you're reading the smaller fonts. Frequent blinking is must, because blinks, they work like a wiper on the windshield of your vehicle. So the normal cornea, when we are looking at something, the mobile or the laptop, we don't blink. And this lack of blinking causes evaporation of the tears from the eyes, and it causes dryness. So the simple lifestyle changes like frequent blinking and maintaining good eye hygiene, wearing glasses. Many people don't like to wear glasses. Now that is a big, big no, because the glasses is like a walking stick. When you have a leg pain, you use a stick and you put the support on the stick. Similarly for the eye, when the eye needs a glass, that means the eye is not able to support the vision. So you need to wear glasses to support your eyes. Otherwise, the eye will undergo unnecessary strain. And very important is 20-20-20 rule. So every 20 minutes, take a break for 20 seconds. Just go around, come back, look at a distant object 20 feet away. So your eye muscles will get relaxed. And I just want to emphasize a little bit more about this healthy eating pyramid. So we have this essential elements like vitamin E. A lot of people say carrots, papayas, all this, these contain this pigments called lutein and zeaxanthin, which is very important for the retina. Essential fatty acids. Then we have vitamin C, vitamin A, beta carotene. So all these essential ingredients are necessary. So if we don't have it in our food, then we have to supplement it from outside. So a good source of protein, and then vegetable salads, complex carbohydrates like millets, brown rice is very good. Fruits and berries have to be included. So what are the equipments we need? So we need, I'm very fortunate in Smart Vision to have a well-equipped setup. We have the OCT, we have the fundus camera, we have the visual fields, we have the laser, then we have the YAG laser for the glaucoma laser, and we have the Alcon, the most advanced constellation vitrectomy suite for cases with complex detachments and oil injection. So these can be all done at our center. So thank you very much for a patient hearing. And for any queries or appointments, you can call up this number. And we are also available on Twitter, Facebook, Insta, and WhatsApp. So we will be very happy to serve you for all your vision needs. Thank you very much.
Thank you very much, Doctor, for the detailed information and some really useful tips to our audience. So we have our viewers posting some questions to us. Would you
Sure,
like
I'll be happy to
have a
answer
few
them.
questions,
Yeah.
please? Okay. We have a viewer. Okay. He has named himself Life is Beautiful. So he has a question for you. Doctor, what is the reason for the loss of peripheral loss of vision?
So as I mentioned, the peripheral loss of vision can happen due to raised eye pressure. So when the eye pressure increases, then the nerve fibers start getting damaged. So usually it is the peripheral nerve, I mean the field of vision in the periphery which starts getting affected first. So when there is a peripheral loss of vision, we first have to rule out glaucoma. Now, in the southern states, we also find a lot of this consanguineous marriages. That means marriages within the family. So, in those cases, what happens is there are certain kinds of inherited retinal diseases, or we call Rechikat in Telugu. So, what happens in these cases is there is a loss of the light receptors in the retina in the periphery. So, that can also cause. So, these are totally purely retinal disorders, inherited disorders. Inherited doesn't mean will happen from right from the birth. It can also happen at a later age group. So we have to have a detailed retinal evaluation as well as the eye pressure evaluation when we have a loss of our peripheral vision.
Thank you, Doctor. So we have Mr. Abdul. Uh, he says, "Dear doctor, please let me know if there are more than one type of glaucoma."
There are multiple actually. I have like this presentation briefly mentioned about open angle and closed angle because they are the main types of glaucoma which we encounter in our practice, where the drainage channel is open or the drainage channel is closed. Now there are certain types of glaucoma. There are secondary glaucomas or complicated glaucomas, where, for example, we have like as I mentioned, like uveitis, that is the inflammation of the choroid layer. It can cause rise in the eye pressure due to inflammation and swelling of the internal ocular structures. So that can cause glaucoma. Then we can have patients who are having retinal detachment with silicone oil injection. The silicone oil bubbles can go and block the drainage channels. So that is a secondary glaucoma after a retinal detachment surgery. Then we have like even newborn babies presenting with glaucoma. So that is called congenital glaucoma, where we see that the baby comes with, is born with a large eyeball, which is constantly watering, red eyes, and these patients have to be checked by the ophthalmologist immediately. So in these cases, the glaucoma is present right from birth. And also there are other types like a post injury, like we see this badminton, shuttlecock injuries. If it hits the eye, it can drainage passage can be damaged, and that can lead to glaucoma. Then we have this medication like steroid induced glaucomas. And so these are the basically main types of glaucoma which we encounter in our practice normally.
Okay. Uh, Okay, so we have another question. Few people get surgery done to get away from spectacles. Even after 40, can we get the surgery and get our vision corrected and keep the specs at bay?
See, after 40, what happens is loss of accommodation. That means we are not able to see the near objects. So then we need reading glasses. So if suppose a patient is having short sight, that means he has a minus power. Then this minus power patients, they always like, sometimes patients come to us after 40 that they want to get away with the glasses. So we have to evaluate them. And if they're suitable for laser and there's no cataract development, then we can do a laser surgery like PRK or LASIK, a refractory surgery, a refractive surgery to get them rid of glasses. But we tell them that especially while reading, you might need to have a small reading glass. Suppose the patient comes after 40 or 50 and early cataract has started developing, then those patients, there is an option of doing a cataract surgery with implantation of a multifocal, like that bifocal or a trifocal lens. A bifocal lens is just like a bifocal glass what we wear outside. We have the technology now to implant these kind of lenses inside the eye. A trifocal lens is an even higher generation lens where we have the intermediate distance also, like while driving or cooking on the stove or walking on the laptop, we can have crystal clear vision. So these bifocal and trifocal lenses are advised for patients above 50 who want to get rid of glasses. So even after 40, we can get this done and get rid of glasses.
Thank you, doctor. So we also have a physical audience here in the room. So Gayatri, would you like to pose a question to a doctor?
Sure. Good evening, doctor. Thanks a lot for sharing inputs, the knowledge base what you have done so far. While you were talking on the peripheral side, I wanted to discuss about this case about the gentleman who is in his mid 40s. He has developed a peripheral strain on his vision, and when visited for 3 4 doctors, they could not identify or understand what is causing this. So, though the regular classes are being prescribed, there is a lot of strain on the patient, and he was not satisfied. Then he really had to push the doctors that to do something because he's still not getting the help. Can you throw some light to what would have been done?
See, after 40, there is a gradual loss of accommodation, as I mentioned. That means the near focusing power gets reduced. So, what we need is that a proper refraction is very important. Refraction means checking for glasses. So, what I do in my clinic is like I do see a lot of general patients who come with these kind of complaints. So, we dilate them. We first check them with like before application of the drops. Then I put the drops and then I do the refraction over the drops. In that case, what happens is the eye muscles get completely relaxed, and then your actual refractive error, how much sight you have, it gets revealed. So then you will be able to prescribe the right glasses for him. Now, after prescription of the glass also, it is very important to check whether the optician has made the glass correctly as per the prescription. So patients who have problem with their glasses, I tell them that please bring back your glasses and get it rechecked in our hospital whether the the glasses have been made as per the prescription or not. Now, another important thing which I like to emphasize here is that people nowadays are going. I also advocate to go for progressive glasses where we don't need to remove glasses, while reading, because many people are, they have short sight, for distance vision is blurred, so they wear glasses for distance, and for near they remove the glass and read. That's not a good habit. We should make a habit of wearing progressive glasses. So in these progressive glasses, what happens is that unlike a normal glass where the entire glass has a power, in a progressive glass only there is a central tunnel which has a power. So the sides, they don't have the power. So if both the eyes are not focusing at that object through that tunnel, then there will be distortions and eye strain will be there. So here the making of the progressive is very important. Wide angle progressives are recommended for such patients. And we also have to see whether the optical center of the glass and the optical center of the eye are matching. If suppose the eye center and the glass center is not matching, then even with a correct glass, he will have an eye strain. So please ask your patient to visit us once possible. If possible, then we will advise in the proper glass. And suppose with the proper glass also he is having an eye strain, Then a detailed eye evaluation to pick up other factors, as I mentioned, like any retinal problems or eye pressure problems. These can also lead to these kind of eye strain, and that can be corrected. Another thing also important here is squint. If there's a deviation of the eye, it may not be visible with the naked eye, but once we do a test called a cover test, we close one eye and then examine the movement of the other eye. These kind of squints can be visible. So a squint eye can also lead to an eye strain. So this is also where there's a muscle imbalance. So both the eyes are not focusing at the same time on a particular object. So that squint problem also has to be ruled out. And in elderly age groups, what happens is that due to some neurological problem or to muscle weakness, these kind of squints can appear. So this is something very important we need to rule out when a patient, having a persistent eye strain.
Doctor, thank you for taking me quite a bit. But I suppose the patient also had a strain, and when approached the doctors, they also checked the glasses, and they have to do some more research because of the patient's demand. It's not because the glasses were not helping, and they found that after scanning, also they could not see anything visible for them, as the report says. So they have recommended the patient to see a neurologist also for that. Then I got to know that he has a cyst on the pituitary gland. That's called pituitary adenoma.
Yeah.
So unless that's been removed, the vision started, slowing down, and it's almost like the patient lost his eyesight.
So that is what another point I want to mention is that any patient with kind of peripheral vision loss or having side vision loss, we do a visual field test. So if this patient had undergone a visual field test, this pituitary adenoma is a cyst or a tumor in the pituitary gland which sits on the center of the optic chiasma. Optic chiasma is the area from where the optic nerves cross. The right optic nerve goes to the left side of the brain, and the left optic nerve goes to the right side of the brain. So there we have the pituitary gland. So the visual field test is the first test which can detect a problem in the pituitary gland and the compression of the optic nerve due to a cyst in the pituitary. So a visual field test would have revealed the reason why he had this. We have many neurologists sending us patients for visual fields. Then another thing I would like to quote here is like there's a condition we frequently see, like patients coming with a headache and eye strain. So especially we see a lot of females coming with headache, and we see the optic nerve. The optic nerve is swollen. So these kind of patients, we ask whether they have any thyroid problem, they have any kind of gynecological issues or not. So there is a condition called a benign intracranial hypertension. In simple words, it is like increased BP in the brain. So the brain pressure can rise, and this rise of the brain pressure can affect the optic nerve also, because the optic nerve goes from the eyes right back at the head where the occipital cortex is located. The visual center in the brain is at the back of the head. So the optic nerve travels through the entire brain. So if the brain pressure is increased, it can affect the optic nerve and cause loss of sight vision. So this also has to be ruled out. So when a patient comes with headache, we just don't say that take some over the counter medicines or this thing. I always have a look at the optic disc and do a visual fields if necessary, if the optic disc is doubtful. And these kind of conditions can be, so there's are neurological problems which can affect the optic nerve, which we have not covered in this session. I also practice neuro-ophthalmology. So we have all this multiple neurological issues which can also be affecting the optic nerve and causing peripheral loss of vision. So these can be detected initially without any gadgets, without any instruments, right, by a basic comprehensive eye evaluation. We don't need any machines to pick up these disorders.
Thank you so much.
We have another question from our audience. Rupa Shanmugam, she has a question, please.
Yeah. Thank you, ma'am. It was great, insightful session. My question to you is for a patient with the high blood pressure. So, what precautions he has to take? And we have seen, like for diabetics, there might be possibility of disease related to high. Is there similar thing for even with IBP?
Yes, high BP, then high lipids like cholesterol, triglycerides, they can cause all affect the eye. So what happens is this high BP, it can cause compression of the veins in the eye and cause a condition called a vein occlusion, where the optic nerve carries the main central vein and the artery of the retina which supplies the eye. So this vein or the artery can get blocked. So this is a condition called a central retinal vein occlusion or a central retinal artery occlusion. So a vein occlusion happens usually in cases where there is a high BP or a cholesterol imbalance. Central retinal artery occlusion happens whenever we have this calcium plaques or deposits on our carotid arteries, that is the arteries which come from here and supply the eyeball. So BP can cause this kind of atherosclerotic plaques. We have this calcium deposits in the blood vessels, and due to the flow, this small clots can get dislodged and they can get implanted in the artery or the vein, and then it can cause sudden loss of vision. Central retinal artery occlusion is a devastating complication which can cause complete blindness. Central retinal vein occlusion to some extent is treatable provided the patient presents early. So we always, whenever a patient presents with such conditions, I always tell them, even if they say I'm not diabetic, I ask them to do a diabetic profile, a renal profile, and a lipid profile. A renal profile is also very important. Kidney is the basic organ which filters all this this uh, impurities from the blood. So if the kidney is not functioning properly, the blood pressure can increase. So the patient may not even identify that he has BP. I asked him whether there is a feet is swelling or not, whether he has any difficulty in during lying down on the bed, whether he's having frequent coughs. So if he says yes, then I get him investigated, and many a times we see that the patient has an underlying renal disorder which was not even diagnosed. So BP, sugar, cholesterol, everything can adversely affect the eye. That's why I was focusing so much on the food, because it's all a proper food which can avoid these problems in the beginning.
Thank you. One other question. Um, you referred that using the progressive glass for long sight. Is that also suggested for both short sight as well?
Progressive glasses are meant for all distances, right from people who have short sight, they cannot see the distant object, and the intermediate, that means when you're working on the computer, it is at 1 meter or at around 55 centimeter at that distance, and the reading distance is around 35 centimeters. So the progressive, the name itself suggests that progressively the power will change from the distance to the near. So you don't need to repeatedly remove your glasses or carry two pairs of glasses, one for distance, one for near. It's very cumbersome. So with a single glass, if it is properly made, I always emphasize on this point that the glasses have to be made correctly. See, in many shops, we see that with 2,000, 3,000 rupees, they're making progressive. And these people, they've actually, ruined the reputation of progressive glasses, because that kind of wide field and all is not possible at this price range. A good quality progressive starts from around 7,000 to 8,000 rupees and can go up to as high as 25, 30,000 rupees. Then we have this night driving, glare problems, all this can be covered with a single glass. So it can act as your shades also. It can act for your cooking work, distance work, intermediate work, and give you a wide range. So you don't need to move your head to see the side. From the center only, keeping your head in the side, you can see through the side of the glass, because that wide angle has power on the sides also. So quality comes at a price, but when it is, we spend so much on so many things, but when we buy our glasses, we keep calculating that which has a lesser price, which is the better price. So the quality, of course, like it depends on, I mean, it comes at a price. So if we invest on a good glass, we will have a good eye health and a comfortable vision throughout the year.
Any recommendation for the reliable store? I mean, where we can reach it, because there are so many.
See, in Smart Vision, we have also our optical center. The advantage in our optical center is just like any other optical center. We have multiple now. We have this online, this glasses made online. So how can you make a glass online? I don't understand. Because you just give a power, but it doesn't give you the measurement, that what is the distance of how broad is your nose, or what is the optical center, all these measurements, what is your this from this side to side length, all these have to be measured to make a proper comfortable pair of glasses. So how can you give all these measurements online? Only a qualified optician can take these measurements and make the glass according to your. Some people may like to wear the glass like this, some people like to wear like this, so everything has to be customized for every patient. And the other thing is, that for example in smart vision opticals what we have is like we have this advanced gadgets to measure these kind of distances, and for progressive we have to understand that when we are looking at a distant object our eyes are straight. As we keep looking at a near object the eyes come close and they come to a converging pose. So that optical center has to be measured in a converging pose. In a medium distance it is half convergent, and at a distance it is fully straight. So all the different distances, the optical center has to be measured. So if you don't do that, then those progressives will not give you comfort, and you will ruin the prestige of a progressive glass. Because I have been wearing progressive glass for the last 15 years, so I'm so comfortable that I always tell them that instead of buying 5 silk sarees, invest on a good glass that is going to give you round the year comfort.
Thank you.
So we have another question waiting here. It's on the screen. Can multivitamins compensate for the healthy diet?
See, this is very important. Multivitamins, it comes in a capsule. So, will you eat your food in a fridge which has been stored for no, months or years? No. We will always like to eat fresh. So, similarly for multivitamins, and suppose somebody says that there is zinc 40 milligrams. So, if you analyze that, you will find that only a certain fraction of that zinc goes into your body. So that is one thing. But a healthy diet, you're eating everything fresh and not a processed one. So this can never compensate. And I have given you the complete list of foods, and every micronutrient is present in the food. But suppose somebody is not able to afford those kind of foods or fruits or anything, then something is better than nothing. We can take multivitamins. But a healthy food, and the other thing is that we don't need to spend too much on healthy food. See, all my slides they are shown different kind of fruits and vegetables and all that. That is not necessary. Seasonal fruits are good. Seasonal vegetables are good. Even our normal birakai chikutka is also good. So they give lot of fiber. You don't need to spend too much brown rice and all. It costs more. Eat your millet. Eat your normal this thing. So suppose when you make idli or dosa, put more dal and put less of rice. So itself the protein content will go up. So in this by small like this kind of fine tuning, we can spend less but eat a healthy balanced diet. So I don't think that multivitamins can compensate for a healthy diet. Our diet is the main backbone of the body. So what you give to the body will give back to you. If you don't give it well, it will give you problems.
Very valuable tips indeed.
Yeah.
So we have one final question. This is the onset of summer. Do you have any uh, tips for our viewers on how to keep their vision safe this in the bright sun this summer?
Yeah, sure. This in the summer, like we have like a lot of this bright sunlight. We need to go outdoors, and so as I mentioned, the shades are must because this bright sunlight can like adversely affect our eyes. Then second very important thing is like we are in a polluted environment. So this pollution, or we are working in the office which is air conditioned. So all this AC outside pollution. So here inside you are in the AC, outside you are in the polluted atmosphere. So both can cause dryness of the eyes. And dry eyes can be very irritable. It can have redness, it can have watering, it can have a gritty sensation. So use of lubricating drops, artificial tears is important. Then third thing, as I mentioned, is like a little bit of lifestyle changes, like frequent taking a small break after half an hour of work, and keeping your eyes closed for 2 minutes after you've seen a laptop for about half an hour. So these kind of things they don't need an investment, but they can prevent dry eyes. And eat good healthy diet because this foods rich in like vegetables, fruits, they have a lot of fluids, so they can compensate. You cannot drink 4 liters of water daily. At least fruits can have a lot of these vitamins, micronutrients, and a lot of fluid also. So these are the particular things we need to be careful. And other thing what we see in summers is like there are a lot of this conjunctivitis, these viral infections happen. So never take go to the pharmacy, take a medicine from the pharmacy. Because there can be medicines which have steroids, and steroids can worsen the infection. So definitely go to an ophthalmologist and take a proper advice before you start on any medication for the eye.
Thank you, doctor. Very valuable tips indeed, and I'm sure viewers have benefited from your talk. Dr. Rajiv, uh, Dr. Rajiv Melon is a joint secretary for the SCSC Health Vertical, and Dr. Raji, would you like to say a few words, please?
Yeah, thank you so much, madam. It was excellent talk. I personally have learned a lot of
We
things.
are unable to hear you.
I am actually unmuted. You're not able to hear me? I am on
Okay,
unmute.
I think there's
So,
some technical issue. So
yeah,
would you
some
like to
technical.
post the comment?
Yeah, I can only say a fantastic talk, and thank you so much for
Dr.
giving us.
Raji, we are not able to hear you. You'll have to unmute yourself.
Just check the chat once.
Okay, looks like there's some technical issue. All right, thank you very much, Doctor. On the behalf of all our viewers and SCSC, I'm sure a lot of people are watching this program and stay benefited. And please post your questions, and we can redirect them to the doctor.
It was a
Thank
big
you.
pleasure coming here and talking in this elite group. And I hope that if I can be able to be of any help for our viewers or the general public, we will be like extremely happy. At Smart Vision, we are all well equipped. We have different centers all over the city, so we are reachable from every corner. And any problem, we are at the service. So please feel free and come to us for any opinion or any problem which you have regarding your eyes.
So we'll soon be coming up with more interesting programs on healthcare subjects. You can please post your request to us, and yeah, we'll ensure we come out to you with some useful topics. Thank you, everyone.